here we are in 2024, still trying to help people, everybody know in long-term care and hospitals and critical access hospitals that falls from bed are bad. Foot first and head first fall. But remembering even that foot first fall from the bed, that is where how most people fall. Many of our patients who fall from beds, they're trying to get to a sitting position, their legs are coming off the side of the bed, so they're not falling head first. Their feet are coming off the bed first, and then they try and sit up, and then they fall over off the bed. But here's what we found, our researchers found, is that if there was no floor mat down and they fall over the top of the rails on that with a normal height bed over the rails, and that would be the high one that you saw, that there's about a 40% chance of having a severe head injury. I mean, that's, 40% chance of a head injury, which can be fatal. Whereas if someone was to fall onto from a low bed with no floor mat down, still no floor mat, they're falling from a low bed onto unprotected flooring onto concrete, there's still a 25% chance of having a severe head injury. Whereas if someone fell from a low bed onto the floor mat, you can reduce that risk of a severe head injury to 1%. So I'm always emphasizing this every time I talk about falls from beds, because they can be grave. People break hips, they break pelvises, they can break shoulders, they have head injuries if they fall without protective barriers. And in this case, floor mats are our best protective strategy.